Systemic Lupus erythematosus SLE. Now, what is the meaning of systemic lupus erythematosus? The word systemic stands for affection of multiple organs. Lupus means wolf. Erythematosus means reddening of skin. Some people with lupus have a red rash over their cheeks and the bridge of their nose because the location of this rash is the same as the common markings of a wolf. In Latin, lupus means wolf was given to this disease many years ago. SLE is the most common type of lupus, is an autoimmune disease in which the immune system attacks its own tissues, causing widespread inflammation and tissue damage in the affected organs. It can affect the joints, skin, brain, lungs, kidneys, and blood vessels. Different types of lupus. Systemic lupus erythematosus is the most common. Other types of lupus include cutaneous lupus erythematosus. Affects the skin. Cutaneous is a term meaning skin. Individuals with cutaneous lupus erythematosus may experience skin issues, sensitivity to the sun, and rashes. Hair loss can also be a symptom. It causes a red scaly rash on the skin. Now, different types of cutaneous lupus. There are three types of cutaneous skin lupus. Each type has similar symptoms, including a red, scaly rash that often results from exposure to the sun. The three kinds of cutaneous lupus are discoid, subacute, and acute cutaneous lupus. Discoid cutaneous lupus. Skin lesions are round, disc-shaped, thick, scaly, and red. May experience symptoms including pain, itching, and burning. In some cases, may not experience any symptoms. Most often, symptoms will develop on face, ears, or scalp. However, symptoms develop on other parts of body too. This condition can sometimes cause scarring and discolorations on skin. Skin can turn darker or lighter. If this condition develops on scalp, it might lead to hair loss, which may be permanent. Discoid lesions, which is shown in this picture, that have been on skin for years can potentially develop into skin cancer. These lesions should be monitored carefully and any changes should be reported to healthcare provider. Second type of cutaneous lupus is a subacute cutaneous lupus. Red borders develop around the edges of these lesions. They can look like a ring with a darker red circle on the ring's outer edge. The skin is red and scaly as shown in this picture. These lesions can result from a reaction to certain medications. They appear most often on the neck, chest, upper back, shoulders, and arms. They typically develop on areas that have been in the sun. They don't usually hurt, itch, or scar. Skin can develop discolored areas. Third type of cutaneous lupus is acute cutaneous lupus. This red rash often develops along the cheeks and the bridge of the nose, usually after sun exposure. Known as a malar rash or butterfly rash because of its shape. A malar rash looks like a sunburn and can also develop on other parts of your body, including the arms and legs. These rashes don't usually scar, but skin discoloration can occur. This characteristic butterfly rash, as shown in the picture, is a sign of systemic lupus. People who develop this type of rash could have lupus symptoms in other areas of their body as well. In this video, we had discussed about what is systemic lupus erythematosus and its types, and cutaneous lupus erythematosus and their subtypes. In next video, we can conclude all other types, diagnosis, and treatment. Thank you.